Good afternoon, ladies and gentlemen. This is Dorothy Mae Mercer for Talk Story TV. We have an interesting gentleman today who's going to talk to you about all of those problems you get when you get older. You know, you got your shoulder, and then there's your knee, and then there's your hip, and then there's your ankle. And oh my gosh, you've paid all this money, and you've bought all these over-the-counter drugs, and you talk to your doctor, and he just tells you, oh, you're getting older there, dear. You're going to have some of these aches and pains. Learn to live with it. Aha, but we have a gentleman who's on the cutting edge of research, and he's going to work on some easier problems, and he's going to tell you how maybe if you just hang in there a little longer, he can take your own stem cells and fix you right up. So before we go any further today, I want to introduce my new friend, Dr. Way, Nathan Way, MD. And notice how he spells his name, because you may be wanting to call him later. And so, welcome to the program, Dr. Way, and please call me Dorothy, and we'll get right to it. Tell us a little bit how you got into medicine.
Well, it's a typical story. My parents were immigrants from China, and they always wanted their children to succeed and to make something of themselves. And they worked hard. They worked really, really hard. And
Wonderful.
I have 3 other siblings, and all of us, we owe a whole lot to our mom and dad. Unfortunately, they're no longer with us. But my mom really sort of steered me towards medicine, and really from the age of about 4 or 5, I knew that was what I was headed for. And
What a wonderful story. The American dream comes true right here in the person of Dr. Nathan Way. That is marvelous. So then your parents helped you, and then what happened?
Well, I went to college and medical school in Philadelphia. Then I went out to your old neck of the woods, the University of Michigan, for residency. And from there, I went to the National Institutes of Health in Bethesda, Maryland, and did mostly arthritis research at that time. And following that, I had to make a decision between perhaps staying in academic medicine or going into practice, and I chose the latter. And at the time, it was a little scary because being an academician is a much more comfortable, stable existence, whereas when you go in private practice, it's risky. But I'm glad. I think I made the right choice.
You did.
And that was about 30 years ago. So.
Okay. And then what was it about arthritis that called you?
Well, I actually fell into it because when I went to the NIH, what they do is they take fellowship applicants and they plug them into different programs as they're needed. And so I was plugged into the arthritis branch, and after 2 years I was eligible to take the board exam, and I passed, and I thought, well, I guess this is what I'm destined to do. And that's what happened.
And I noticed by your biography that you have really become very, very well known and liked in your field. You mentioned that you've been published in 65 medical journals and review journals by your peers, and you've appeared on television, NBC, PBS. You've been featured in magazines, Arthritis Today, of course, and Women's Day, Washington Post, Martha Stewart. And here you are on Talk Story TV, and we're so happy that we have you today and hope that we can reach a lot of people with your good news. Tell us a little bit about the latest thing in osteoarthritis.
Okay, as baby boomers enter this period of their life, and there's no question that that's where our demographic bulge is heading. One of the things that prevents us from being able to to really enjoy life is the fact that the cartilage in our joints begins to wear away.
Yeah.
And that's really what osteoarthritis is. It's the most common type of arthritis. It is the most common cause of disability. It's a very expensive condition, particularly when you factor in the reality that a lot of people will eventually have to have joint replacement surgery.
Yeah.
And I'm going to back up just a bit because the treatment for osteoarthritis hasn't changed in the last 50 years. It's primarily been symptomatic. We use anti-inflammatory medications, we use physical therapy, we use different types of exercises, we use different types of injections, either with cortisone or with those lubricant booster comb injections. But those don't really slow the progression of disease, and they certainly don't reverse the cartilage loss. And so the ultimate outcome is a patient goes through this series of symptomatic treatments and then ultimately winds up in the hands of an orthopedic surgeon who then replaces their knee or their hip. And that replacement, the surgery is not without risk. It's a major procedure. And secondly, that appliance 15 years, and then it has to be redone. So if we're talking about a healthy baby boomer population, let's say you get your knee replaced at 60, then you're talking about, and you want to stay active, you're going to have to get it redone again at then again maybe at 82, and maybe if you're lucky at 92. Not very pretty.
Yeah, and the rehabilitation period is so long and painful, and a lot of people just never really recover completely.
That's correct. That's correct. So we've looked for alternatives. We've looked for different methods to try to slow cartilage loss and to perhaps restore normal cartilage. And so a number of clinical trials have examined different chemical compounds. But one thing that's very interesting, and this is something we've learned from nature, if you cut an earthworm in half, it regenerates the other half.
Yeah.
And why is that? Well, it's because earthworms are primitive enough that they have these stem cells that really are just unbelievably powerful in their ability to regenerate body parts. What a lot of people don't know is that we also have cells that perhaps aren't quite as strong, but certainly are capable under the right circumstances of doing something similar. An example would be, let's say you cut yourself. Why do you heal? Well, you heal because you have stem cells that actually go to that wound and heal for you. And so we all have stem cells present in our bone marrow, in our fat, a few other areas, and if we can harness that power and combine our own stem cells with growth and healing factors, it looks as if now it's possible to actually regenerate cartilage.
So you harvest the stem cell from somewhere in the body, and then you do something with it. You inject it into the joint, or where? What do you do?
Well, it's not quite that simple. Once we harvest the stem cells, we go to the area that needs to be treated, needs to be fixed. And by using diagnostic ultrasound and arthroscopy, we're able to see exactly where the damage is and the extent of damage. Now, stem cells, in order to begin to work, have to be triggered by something, and they're triggered by injury. So what we have to do is go to that area of damage. In an osteoarthritic joint, that area of damage is usually an area of bare bone, and we actually damage that area of bare bone. We actually go into the to the marrow. We create an acute injury. We then take our stem cells and other growth and healing factors, and because we know exactly where this area is, because we're using our arthroscope to look, we can put our material directly where it needs to be. And then we get cartilage growth.
Sounds wonderful. So does it regenerate the bone or just the cartilage?
Cartilage.
Okay.
Yeah.
But bones can heal, can't they? I mean,
Absolutely.
You break a bone?
Yep. Let me back up a bit.
Okay.
When we do damage the bone, yes, that heals also. That heals also. So that, in essence, what we're doing is we're inducing a small fracture in order to create injury. So that little fracture area heals, and on top of that, cartilage grows. So the end result is a functional joint.
Up to now, it just surprises me that they haven't been able to invent some kind of artificial cartilage and just put it in there.
Actually doing something like that now. In animal models, they are able to now take stem cells and make them grow cartilage in a petri dish, and eventually they're going to be able to take a whole piece of cartilage and perhaps put it in there. We're not quite there yet with people, but with people, I think that that the ability to use a person's own stem cells, and we call these autologous stem cells, is very promising.
Have you actually done this with people?
Yes.
Yourself?
Yes. In fact, 2 years ago, we published the data on our first 25 patients with osteoarthritis of the knee. And the results are very encouraging. I'd say that and we're still following these people along because in order to see whether the stem cells are going to be a viable option, you want these patients to get long-term results, 5, 10, 15 years. And so we're following these patients, and so far it appears that we have about a 90% success rate with osteoarthritis, and that's very encouraging.
Oh, that's incredible. Wow. And so are you are you still in the research stage, or has this become more widespread out among other surgeons and other doctors?
There's a lot of interest in the use of stem cells, more so than there was, say, 2 years ago, 3 years ago. The problem is that it's still considered investigational, so that the accumulated experience that we have in people is confined mostly to case reports, small series of patients, and what we really need to do is develop a type of study, a larger study, where we're looking at a larger population of patients and study them in a randomized, controlled fashion, scientifically, so that we can determine how well these stem cells work and for how long.
I don't suppose the insurance companies are paying for it yet, then. It's
No,
still
they're not. They're not.
Cutting edge.
Exactly.
So, do you do this? Do you have grants to do this research, or do you just take private pay?
So far, it's private pay. However, we are going to be speaking within the next month or two with people at the National Institutes of Health, possibly to be able to conduct a study like I just described.
It sounds as if once you get this to be, you get to the point where you can do this with multiple people, that it's not going to be as expensive or as complicated a procedure as having a artificial joint put in and going through all that therapy and everything. I mean, it's just a little bitty incision, right?
That's correct. That's correct.
It's wonderful.
And Dorothy, can you excuse me for just a second? I think my power source is going.
Okay.
I'll be right back. How's that?
It's okay by me. You had to plug in, huh? Well, that's one of the things that our instructors tell us. Do not operate on battery. It's not as good as plugging it in.
You got it.
There's so many instructions, and you're too busy to read them. I know. So moving right along, I'm sure you've really got people sitting on the edge of their seats, and they can't wait to get down there and get it done. So right now, it's just to the point where you can take a few patients. You'd like to do this study. You need to get financing for that, though. You think the Institute of Health will come up with money?
I don't know. You know, this is one of the difficulties with using something that already belongs to you, because, you know, pharmaceutical companies aren't interested in funding anything like that, right? So that's one of the difficulties we have.
It's got to be government funds. And right now, everything is up in the air. I mean, who knows what the heck is going to happen with medicine? And they're still writing the rules. So, well, maybe this will help. You know, maybe you can get your senator to look at this video. Maybe, you know what I think is going to happen? Maybe our president will get a little older, and maybe his joints will start hurting. Think about that. He's going to have to do something.
Well, I mean, you know, you raise a good point in that if you look at the economics, a knee replacement surgery costs around $50,000. A stem cell procedure is about $10,000.
Even now?
So
only 10?
Only 10.
A lot of people can afford 10,000.
Yeah, 10's still a big figure, but compared to 50,000.
Yeah. And think of all the people who they're paying part of their own, even though they have insurance, they're paying the minimum, whatever the deductible on a heart surgery or knee surgery is probably close to 10,000. They can afford to come up and talk to you. Maybe what we need to do is to get people to sign up for this study and tell them it's going to cost them 10,000. You think? Might
I don't know. I don't know the solution. What I do know, though, is that, you know, the opportunity to offer people an alternative to joint replacement, I think, is exciting. It's very gratifying.
And think about it. If supposing you're an athlete, you play basketball, you're a runner, you're a football player. Younger and younger people are having their knees go bad, their hips go bad, because they put so much stress on it. And these people, just think about it. If they get their cartilage repaired and their bones repaired, they can play basketball another year, you know? So they can run another year. I wish I could still run. I love to run, but I know it's not good for my knees and my hips, and so I just walk. Well, doctor, I think you've made a good sales talk. Is there anything, I've run out of questions. Is there anything more you want to say to people out there?
Other than, you know, have hope. If you're active, this is the type of procedure that probably is good for you. The people that really do the best with stem cell procedures are athletic, active people. These are people that want to continue to do things. We see a number of ski instructors and actually marathon runners and triathletes who've done extremely well, gone back to doing those things. And it's really neat because they send me pictures of themselves, in these competitions, and it's great. It's really neat.
Yeah. Well, I think a lot of athletes start having pain while they're still in their 20s and 30s, and they take aspirin, they take ibuprofen or whatever, and they live with it for 20 years before they go get a joint replacement, because we know how much trouble joint replacement is. We do everything we can to avoid it and put it off as long as we can until we're 40, 50, 60 years old. And then you're walking around with a cane for maybe a year before you actually can really walk again. Now, all I want you to do, doctor, is to tell me how soon you're going to get it so I can get my thumb fixed. Oh, goodness, because that's a joint just like any other joint, the difference being it's smaller, maybe, but it's more needed. Think about all the things you do with your thumb. I mean, you got to hit that computer keyboard. So,
that's right.
Let's call it a day for now, but before we go, we got to tell people how they can reach you if they're interested in having this done right away. I know you told me the arthritistreatmentcenter.com. That's your practice where you're in with some other people. arthritistreatmentcenter.com. And also, Dr. Way has do you have a website or a phone number or something you want to give people?
Yeah, the phone number to reach us is 301-694-5800. That's 301-694-5800. We're located in Frederick, Maryland. If people want to go to another website where they can see a lot of videos, if they go to stemcellsarthritistreatment.com, there are a ton of great videos there. And that's pretty much it.
I didn't get the name of your town. Maryland?
It's Frederick, Maryland.
Oh, Frederick, Maryland. Okay. Not too far from Washington, D.C., right?
Probably about an hour. Not too far at all.
Okay, you're out there in the nice suburbs where they have the big houses along the river, along the Chesapeake, or are you closer to the ocean?
We're actually closer to the mountains. We're in the western part.
Oh, I didn't even know there were mountains in Maryland. In the northwest?
Oh, yeah. In the northwest.
Okay, you're closer to Pennsylvania then, up that way. Okay.
Yep.
Well, I have an idea where you might be. I have a family that live in the suburbs and work for the government and that sort of thing. So, okay, well, we're going to sign off for today. It's been great talking with you. Appreciate your expertise and your time. And you can look forward to being broadcast in a little while, maybe a few weeks, on Talk Story TV. We'll notify you by email when that is, and in the meantime, if people are watching right now, they can talk with you on the blog, and maybe you would answer their questions. So this is Dorothy Mae Mercer signing off for Talk Story TV. I'll see you again soon, and God bless you. Goodbye now.
Bye-bye.